Hi, I'm Mélisande Rouger, Editor-in-Chief of Diagnostic Imaging Europe. I'm at the SERAM 2024 meeting with Kai Vilanova. He's head of MRI at Clinic Girona here in Spain. Hi, Kai.
Hi, hello.
Hi. So a speaker at the meeting just mentioned that there's been an increase in cardiac MRI examinations of over 500% over the past 15 years. Is that something that you can confirm?
Well, I must say that, it's already about 15 years ago that we started with cardiac MRI. At that time, probably we performed no more than 5 examinations per month. We started slow, but what we did is we incorporated in our team cardiologists. So also this was also quite change. And of course, it has been 15 years, but now in more recent, I would say 2-3 years ago, this has been the high demanding. And now we are performing about 15-20 examinations per week. So this is a big change, and this is just to confirm what you have seen, of course, in the Congress.
So very true in Spain.
That's a very high demanding examination that has changed from the last years. Yes,
okay.
Yeah.
There's a project of having a contrast product media here in Europe that reduces the amount of gadolinium that's necessary to carry out an MRI examination by, I think, 50%. Is this an interesting project for you? Would this be something you would be happy to use?
Well, yes, of course. This is a project. It was almost going to be in the market just now. But well, for instance, it was today that I requested why there is this still that we don't have it, but it's going to be soon. And for sure, this is going to be when we have this product, because as you say, it is going to reduce the amount of gadolinium. So this is important, that we're going to have with the less gadolinium, the same information. And of course, we know first, this is a drug. This is an injection, even this is a contrast that sometimes seems that there's nothing. No, this is a drug, so this is like antibiotic.
Sure.
So we know this is not just innocuous, let's say. And the second is the money, the cost. Okay, so we will reduce cost, and we will reduce toxicity. So this is a big project, an expected project that for sure in the few months we might have it. So I will be, and this morning I just asked that in recent time we are going to have this. Yes.
Great. So very much expected,
yeah,
right?
Yeah, for sure.
Okay. What about AI? How do you work with the technology at your practice? Where does it make more sense to use it?
Well, precisely, we have just finished a session with a debate with AI. In this case, it was on musculoskeletal radiology, but it's similar to any area. So we have done a question to the audience. There was almost 200 people and I asked how many were using AI, and for me it was a kind of surprise, because it was 45% of the attendants that were using some kind of AI. So for me, it's quite high. So I didn't expect this number. So 45%, let's say, today here that are using already a tool of AI. Of course, we have different tools of AI and that's one of the tools that I'm using for acquisition from the MRI. So I have AI incorporated in my examinations of MRI, that it reduces the examination, the time of the examination, so less time, but on the other hand, more resolution. So we are going to have better images, so patient less time in the MRI, so this is more comfort for the patient, and then for us, better images, so we might have better diagnosis. And this is one of the tools that we can use, and this is my experience that I'm since 8 months ago that I incorporated. But then also it has been talked in this session, diagnosis. So there are tools for diagnosis, especially in emergency room, for fractures of the bone, for the thorax, This is very useful because there is no radiologist to examine, of course,
Sure.
in the emergency room. So then the medical doctor has this tool that it helps, and it has shown the good results. For the main purpose is plain film of the thorax as a screening, well, as the emergency room, and for bone fractures. This is a tool that is already today in the hospitals. Also for reporting, automatically reporting. So this is another tool that is already here that it can be implemented in our departments. So there are different artificial intelligence tools that today are already in the departments, and they are going to help for sure, and they are helping us already in our department. Yes.
Okay, great, thanks. And one last question. You will be hosting the ESMRMV in Barcelona in October. Can you give us a few hints as to the highlights of the show?
Yes, this is the European Congress of MRI, so everything. And the important issue is that it's not only for clinicians, it's for researchers, and also for radiographers. So this is the ones that perform these examinations that we're talking, and it's very important that this examination has to be performed in good quality. So this is a congress that everyone that is involved in MRI, we will be in October, and we will talk of different topics, very important, not only for diagnosis, because MRI is not only a tool for diagnosis, so also for intervention. So we are going to do and to show how we can perform intervention in an MRI that today we can perform very specific interventions. Also, we know that MRI is not only a morphological examination, so it's a functional information, because we have to know that MRI is a biochemical technique.
Yeah.
So that's why there is a lot of information. And all these different types of information, we will dedicate different sessions. And this is what in 3 days in October, we will be here also in Barcelona,
again.
for the Congress.
Well, I'll be sure to be back. Thank you so much, Kai, for your time.
Thank you.
Thank you for watching.
Thank you.